Welcome to our second panel hosted by Save British Farming. Today we are discussing the Agricultural Bill and its links with public health. I'm Gemma Lane, I'm one of the campaign coordinators, and today we have with us Liz Webster, who is the founder of Save British Farming. We have Sophie Medlin, who is a clinical dietitian, and Gabby Moores, who is an NHS dietitian. So Liz, starting off, could you just explain why the Agricultural Bill is going to impact public health, and then our experts can take it away.
Okay, yes. So I think it's really, it probably is the case that a lot of people don't really understand where their food comes from. But most of your food in Britain comes from British farms. It is a fact that the majority of the food that we consume is British. So the bill that's going through the House at the moment is going to completely change the structure of which we have had since the war. And the government are no longer going to subsidise farmers or landowners to produce food. They're going to actually subsidise them to park keep, really. We already do a lot of park keeping, but to do more environmental things like plant trees and so forth. So they're going to be removing food security, which has always been seen as a public good. They're not going to see that as a public good any longer, and they're going to fall to rely on the markets. So basically, it's like privatising our food, really. And then by weakening the protections for imports, so the laws around the standards which are used to make that food, it means that lower quality food can come in from other countries where they have much lower standards than us, and other countries probably have a lower currency, so it's going to be a lot cheaper than the food we produce, which means that inevitably British farmers won't be able to compete. The market share will shrink for British farmers because only the wealthiest will be able to afford quality products, and that means that the public health of the majority is going to be endangered, really. It's going, because the majority of people are only going to be able to afford to buy the cheapest products as people become given the worst choices of being in there with a weekly budget. It's not about if you win the lottery, you're going to buy the most expensive, but most of us who are on an average wage are going to be forced to buy the cheapest products. So we have got a chance to change direction on this, because at the moment there is no divide between rich and poor. Everything that we eat is produced to a good standard. So that's what we are fighting to change. So I hope that helps.
Sophie, Gabby, would you like to take it away about what are the risks of accepting these lower food standards through this agricultural bill?
So my greatest concern really is the health gap that we already have in this country. So whilst Liz is quite right, the quality of meat, for example, which is a really important one from a health perspective, the quality of meat in this country is reasonably high, particularly when we compare it to other parts of the world, and we're very lucky to have that. Those of us who are fortunate enough to be able to make choices about the food that we eat every day and are never worried about food security, so we always know where our next meal is going to come from, we have the privilege of choice. Whereas the poorest in our society, and let's be clear, particularly following things like COVID-19, the use of food banks is very high, even amongst people who are working professional jobs like nurses. We've seen the headlines, everyone knows about this divide that we have in this country. So in terms of nutritional well-being, the richer you are, the better off you are, and the poorer you are, the more your health is likely to suffer as a result of your diet. We know that things like chicken shops are feeding the majority of young people in London, and that's a risk. If we have cheaper meat imports, the chances of those smaller chains or those smaller shops using the cheapest possible meats is very high. And that really is going to expose those who can at least afford, so those who can least afford the risk to their health, it's going to expose them to even greater health risks. There's nobody in the world, or hopefully nobody in the world, or particularly in this country, who would look at the American food system and the health of Americans when we think about things like diabetes and obesity and think, yes, we want some more of that in this country. we're staving off that being quite to that level in terms of our public health risk, but bringing something in that puts us at higher risk is absolute madness to me. And I think we need to really fight this, primarily to protect the poorest in our societies who rely on cheaper foods more than the rest of us. We need to be able to fight for the protection of those who can least afford the risk to their health or increased risk to their health.
So Gabby, I know you've done a lot of research for the campaign on the health impacts. Could you maybe talk us through some of the risks with importing US meat?
Yeah, absolutely. So one particular area of concern for me is the use of antibiotics. So since 2017, the World Health Organization have made it abundantly clear that we should stop using antibiotics unnecessarily in rearing cattle. Now, you can use antibiotics in cattle rearing for therapeutic reasons, so the reasons they're intended for, which is your animal is sick, it's got an infection, it needs antibiotics, we should treat it. That's a good use of antibiotics. A bad use of antibiotics is just blanket covering your animals with antibiotics to prevent them getting infections. And what that infers is that the animals are being kept in poor conditions where disease is just spreading. So what we do is we just treat them with antibiotics, fine, they won't get disease. And there is also some evidence that if you use antibiotics at a slow rate, just as the cattle are coming up to being reared, it will increase their muscle mass, so it makes them more profitable. But these both are inappropriate uses of antibiotics in animals. And the reason that the concern is that if we drive antibiotic use in animals unnecessarily, it drives antibiotic resistance in humans. And since 2017, the World Health Organization has been absolutely clear on this stance. And it's been something that the whole world has been trying to reduce their use of. And the UK, we've done exceptionally well. I think we have reduced our antibiotic use by somewhere between 50 to 60%. Which is fantastic. The USA, however, the government has taken a very dormant stance on it, and eventually their kind of food safety regulator has tried to phase out the 8 most commonly used antibiotics, but what they've said is that they can use structurally similar antibiotics instead. So they're phasing them out, but you can still use structurally similar antibiotics. Therefore, if we start importing more US produce, more US cattle that is blanket treated with antibiotics, it will drive antibiotic resistance in the UK population. And antibiotic resistance in the UK population is as serious a health threat as any other. It can lead to things like longer illnesses. You'd be more likely to be in hospital from an infection. If you're resistant to antibiotics, you can't be treated at home. You're going to have to come into hospital. And ultimately, it will lead to more deaths.
Yeah, and I think so. I used to work in the NHS, and during my time in the NHS, I saw more and more antibiotic-resistant infections. Yeah. And I haven't been in the NHS for about 5 years, a bit longer now. Gabby, what's that kind of level of antibiotic-resistant infections like now in hospitals?
Oh, enormous, absolutely enormous. And like I personally work in elderly care, and so it's something we typically see with elderly people is them coming in with UTIs that they couldn't treat with antibiotics at home. So they're coming in for a really high dose of antibiotics. So we've got an increasing elderly population and a population who's at risk of becoming increasingly resistant to antibiotics. And I'm really scared. I'm really, really scared of what this will do for the health of our population.
I guess especially if children are exposed over a long period of time to drive antibiotic resistance for them in the future. And I'm conscious, and I know, Gabby, you are as well, about how we may well be able to sort of make a decision if we pick up a packet of meat that says it's, whether it's UK grown under particular circumstances and standards, or whether it's imported, we can pick up some meat and say, make that decision. But in things like school cafeterias, in outlets and those sorts of things where you don't know what the source of the meat is, people aren't going to be able to make an informed decision. And the schools, nurseries that the poorest in our society have to access, there's such a risk there to people.
There's also the fact that when we go on to WTO, that we won't be allowed to label the food origin. So you won't know where it's coming from, even in the supermarket. So the red tractor that people now have faith in, of knowing that it's a British meat, will disappear. So unless you actually buy direct from a farm, which is nigh on impossible these days because of regulations. None of us are allowed to slaughter, well, unless you've got extensive facilities. Not many farms have slaughter facilities on their farms. So yeah, that's the reality. So I think a lot of people think when they go to a farm shop that everything in the farm shop is being produced at that farm, but that is not the case. You know, it is, they obviously have to fill their shelves and source whatever they can from the local vegetable market or from the local butchers. But as farms go out of business, then that system, which is already very centralised, will probably be pretty much decimated, particularly for beef and for lamb.
I think we could all agree that there will be a common misconception that vegans or vegetarians will be let off in terms of their effect on the food standards, but that's just not the case. And I know you guys have done a lot of research on this. Could you give us some examples?
Yeah, of course. So I think bread is the best example, actually. So when we're talking about pre-packaged, mass-produced bread, so just the things you buy in the supermarket, your sandwich bread for the week. So in the UK, under EU law, all these kind of additives and nasties, they're banned. They've been banned for well over a decade. American bread contains two additives called potassium bromate and azidocarbonamide. And both of these are used for making plastics foam, and they are potential/known carcinogens, as in they cause cancer or potentially cause cancer. And the EU, for well over a decade, has said these are absolutely not allowed in our foods and our bread, for example. But in the USA, these are commonplace in their mass-produced bread, and that worries me because we don't even know the extent. We don't even know where else these additives might come up in our diet if we start trading with the US. So it's not just meat, it's also just bread as well. It's really worrying.
Also things like food colorings, you know, we have particular regulations here that protect us from food colorings. I think the UK and also Australia are quite good at managing food colorings in foods, particularly for children who suffer with hyperactivity and things like that. There's just very, very direct links. Whereas in the US, you're allowed to pretty much color whatever you want with whatever you want. And that you see that, you know, if you've been to the US and you've shopped in and bought candy in the US, you can see that it's a very different market to ours. And again, it is those who can least afford those risks, those who are relying on cheap bread from the supermarket are going to be more exposed to things that are actively dangerous for our health.
Absolutely.
These things blow my mind. You're very helpful in explaining the situation. Could you maybe explain for people that aren't nutritionists or dietitians or work in the food industry why there is such a difference? I briefly understand that it's because the way that we protect and monitor food, that we make sure something's safe before selling it, as in the US, I think we have a different approach.
So under EU legislation, so the EU is often seen as being too safe, which I just don't think you can be when it comes to food. And so there is really strict legislation in the EU. If an additive or a hormone or anything that can be used to treat food in any way, if there's any doubt over whether it might cause harm to humans, the EU just bans it. They protect our health. But the US, they have the Food and Drug Administration. That's their food and drug regulatory body. And they just take a very lackadaisical stance on it. It's very, things move through very slowly. And in fact, I think someone was quoted from it once to say that it just wasn't in the interest of the FDA to try and review some of these products.
I think as well, it's my understanding, and I haven't done anywhere near as much reading on this as Gabby, but it's my understanding that the US kind of food industry is very much economically driven in a way that perhaps, obviously the UK food system is economically driven, but in the US there is economics is perhaps prioritized over health at times in a way that's not the case in the EU. So we're slightly affected from those economic factors which drive decisions. So if in the US farmed animals, for example, are kept very close together in very poor conditions, and they have to have loads and loads of antibiotics all the time to stop them getting diseases, but the output is huge, they can provide cheap meat that feeds plenty of people. then the USDA are pretty happy with that. Whereas in the UK, in the EU, as it stands, we are protected from those kinds of lower standards. So I think it's largely economically driven in the US in a different way to how it is here.
Absolutely. You know, and half the, so when I was talking about the additives that are used in bread, for example, it almost always comes down to cost. So they're just cheaper than having an alternative in them that isn't carcinogenic. And the FDA just allows it to happen because, like Sophie says, it is purely economic and cost driven.
Liz, would you say, going through all of your meetings with MPs and the Lords and DEFRA, would you say that that is their focus, that we're moving towards a more US approach to our agricultural system where it is more economically focused rather than health?
Well, when you look at what's going on with the pandemic at the moment, this government are just fantastic at saying what people want to hear and then actually doing the polar opposite. So when I look at the evidence, when I look at what they're saying, it sounds reasonable. And then because they promised in the election to uphold our standards, and now they're actually delivering the polar opposite of that. They say we've got a world-beating test and trace system for COVID, and it's completely and utterly not working. So looking at the evidence of what they do, it says to me that they are not putting the people first. And that is a massive concern. And in terms of food and illness, we have a pandemic here, which is from a human eating food, which was a bat. And we have these standards here in Britain and in Europe to stop those kind of things happening, because as we've had instances of a food-related condition, we have acted to stop it happening again. And that really makes sense. So, you know, we had the BSE crisis, which was massive. We had the foot and mouth crisis. We had the egg salmonella crisis. And all of the legislature that we have currently is learning that we've learned from previous mistakes to protect human health. And I think we all, if we all sat in a room, would agree that it doesn't matter about, you can live without a TV, you can live without a phone, but none of us can live without food and, okay, water and shelter. They're the only three things that matter. And so whilst 4 years ago people marginally in a vote voted for something which seemed pretty vague and it wasn't clear what they were promising, really, they didn't say, Britain, do you want to turn and eat American food? And I think the answer would have been different if they'd done that. But now we're at the end of the process. Now it's clear what they are trying to do, and that is the case. They're thinking, we want the deal with America, probably because it makes it easier to trade, maybe for the, you know, financial services and those kind of things, deregulating those kind of things. But the downside of it is that the American corporations, agricultural corporations, which are hugely powerful, are insisting that they have access to our food market. And you know what? I say, no, you're not having it. So we should all join together and fight for all of us, because I think British values are completely and utterly opposed to the thought of having a country which is just ensures an absolute race to the bottom.
So moving forward, if we were to allow these lower food standards into our country, Gabby, I know you've looked into a lot of this. Will we see a rise in food-borne diseases?
Oh, this is another area that for me, and this to me is kind of the more immediate effect. So with like the antibiotic pumped animals and possibly like carcinogenic additives in our bread, those are kind of more long-term problems where we might start to see development of cancers. Long-term, short-term problems is absolutely going to be food-borne illnesses. So I think, so we must say first, it's not actually directly comparable. There's different study designs and different data collection, but in the UK, we report incidences of food poisoning as 1 in 66 people per year, which is fine. The US reports 1 in 6 per year incidences of food poisoning, and that's got to be related to their food standards. So, for example, something that particularly horrified me was that the FDA, so that's their food regulatory body, they allow for these things called food defect levels. So these are levels above 0, and they're set to an upper limit, which certain things are acceptable to find in our food. And these things include mold, insects, insect filth, rodent filth, rot, grit. So, for example, the one that struck me the most was that in 25 grams of paprika, there is allowed 75 insect fragments, 11 rodent hairs, and an average mold count of 20%. And this goes across the board for actually a lot of staple household spices, herbs, fruits and vegetables, whether they're fresh, dried, tinned, frozen, canned, eggs, nuts, and coffee. So when you're thinking about finding rodent hairs in your paprika, this is just not okay. This is really concerning to me because, eggs are a staple of the British diet, and I think about all the millennials who just love having their poached eggs and avo on toast. All of a sudden, these food standards are affecting us even just on a day-to-day, on a breakfast level. And it's worrying. I wouldn't want to see any one of my family suffering from salmonella, from infected eggs, when this is a problem that we haven't had for years.
Sophie, have you got anything you'd like to add to that area? There's so many facts in there, and it's just terrifying to think of.
Yeah, I think it's a real worry. I think, again, we have such a large portion of vulnerable people in every country, but the thought of people who, elderly people living in care homes, that kind of place where, chances are we're going to be using cheaper food imports if this system goes forward. The risk of food poisoning in an elderly person is death. Like, that's what happens to elderly people who get food poisoning, because maintaining hydration and things like that is so difficult for us whenever we're vulnerable. Same with babies and children. Food poisoning is life-threatening for babies and children. And yet we're, quite happily, or the government, let's say, are quite happily sort of suggesting that this is just what we do and we allow it through and this is how it's going to be. I feel, and I'd be interested to hear what Liz thinks from the meetings that she's had about, are the government really making this link between health and food? And if they're not, then how have we got to this point? We are suffering in this country with such terrible problems with our food industry impacting on people's health, but also general day-to-day health of people in the country, which is impacted by food. And yet we're talking about these major changes to food in this country. Has that link been made? Are people really saying, oh yes, this will impact health negatively, or is that just not quite on the agenda yet?
I think that this particular vote leave government buy into the American model of really being driven by profits and by the markets, and there is zero empathy. And I think they probably buy into it's been well reported that Boris Johnson is a believer in survival of the fittest. And in effect, that means survival of the richest, really, when you translate that into reality. And that just goes against everything that I stand for, but it also goes against British values. Everything we learned from the last war has led to where we are today, which is to do with protecting and sharing and looking after our vulnerable, not leaving them to eat, substandard food. The other issue as well, which we haven't touched on, because again, the other big thing for British people is pets. That pet food is going to suffer as well. So it's not just the humans that will suffer. Our pets will suffer too, because you can imagine what's going to go into the pet food. At the moment, all our pet food is made in Europe. It's processed in Europe, nearly all of it.
It's such a worry, isn't it? And I do completely agree, Liz, that we are in this space where the government just really only are interested in survival of the fittest and the wealthy continuing to gain wealth. And unfortunately, the impact of this is going to be on the NHS. We're going to see a huge impact of this onto NHS services, which we all know are already massively overstretched. Everyone's struggling. We're losing doctors by the day because of how ridiculous the health service is, let alone dietitians and everyone else. And the funding for the NHS is so crucial, yet that's being cut back on, and we're putting the health at potentially putting the public at such greater risk again.
Well, unfortunately, again, because when you look at the American model, they have a private healthcare model, and that really falls into that same belief structure. that, if you're rich, you can afford to have the best healthcare insurance, and if you're poor, or if you're born or get health related issues, you're not going to get any health insurance. You're not going to be covered for it. I mean, both my children, who are in their 20s, one has a serious brain injury from an assault, and the other one has a degenerative eye condition. So both of them are in their mid-20s are going to find it really difficult to get healthcare. It's going to be very, very expensive. So I think, to me, it looks like that is the route they're going down. Now, they couldn't sell it to the public by saying, hey, public, do you want to have this awful American food and this awful American healthcare system? And they're kind of kettling us into a catastrophe, which then ensures it's kind of like, oh, whoops, sorry. And it happened actually with the NHS dental care. The system collapses pretty much. And it's kind of like, well, if you do want to have any form of decent service, you've got to pay for it.
Yeah.
I mean, that worries me so much. The whole health service situation worries me so much. And again, you're quite right, Liz, in saying if the general public was said, do you want a food system that leads to this level of lifestyle related diseases, this level of food poisoning, blah, 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 and a healthcare system that looks like this, that creates these problems, that people are having to borrow money to pay for their children's insulin and whatever other mess is going on, people would say no. But at the moment, I think the government's kind of stance is, well, you wanted to leave the EU, and this is the consequence of leaving the EU, so this is what we're going to do.
Yes. I mean, that's what is going on. And of course, a lot of people see elections, and it's all through the media in terms of who they like as a person. And the Conservative manifesto was so thin last election, there was hardly anything in it. And now everything is being centralised and changed to an enormous degree. And then also they distract everybody with arguments about, race wars or that kind of thing. So I hope that people are, do wake up to what's going on, because once this change happens, it's going to be incredibly difficult to go back to the very high standards that we've enjoyed for so long.
Well, probably impossible realistically, because British farming, I mean, you guys have discussed this extensively, I'm sure, but the ability for British farmers to maintain their income, if we go to the model, is going to be so slim that if we did try and take a step back and rejoin the EU or join some of the regulations, the infrastructure is just not going to be there, I can imagine. Well,
if people keep farming, they're going to have to rip out hedges. There won't be any at the moment we have margins around the field to ensure that wildlife is encouraged. There's lots of things that we do to make sure that farming is sustainable. All of that will go out the window, so it'll just be huge about returning huge quantities of grain. I think for the livestock farming, I think it's over. I really do. I can't see how there's going to be any or much of a market for beef and lamb, and I'm not sure. At the moment, pork does okay because it's actually exporting to China, but that might not carry on because they had the swine flu over there. But in the long run, it's incredibly sad, and so farms will have no choice but to turn into something else. Industrial areas, housing areas, holiday camps, I don't know, you will find that the land will be used for something else. And so to get that, once you put a concrete housing estate somewhere, it's not ever going to come back to farmland.
I think everyone will be safe to say that if you ask someone whether the agricultural bill will affect their health, not many people will actually make the link to public health. And I don't think it's written about enough in press. I don't think it's been focused enough even in the agricultural bill itself about protecting the specific food standards that are being imported. As a result, it will protect our NHS, it protects our public health, it protects our environmental protection, it protects food security. It does so much, and it's very important that people like yourselves are getting the word out and helping us make that link. But I do think it's under talked about. Maybe you guys could explain who exactly will be affected, because obviously everyone eats food, everyone will be affected by this, but I know that it's going to widen the public health gap. For example, you've already mentioned vulnerable groups that could die from foodborne related diseases. Is there any other particular sections that you're really concerned about?
I think an area that I'm actually, or a population who I'm worried about, is actually students, because we're talking about people who are who are in our lowest socioeconomic groups, who have the lowest disposable income, and they will absolutely be affected. But we also think about students who notoriously have very little money, learning how to cook and feed themselves for the first time. If they see something that's cheap, of course they're going to go for it. And then thinking about, just after you've graduated as well, you're trying to get yourself on your feet. Food is something that you can compromise on when you're living on a budget. And my concern is then that we actually have, students who are trying to thrive academically, who might not be able to if they're being struck down by food-borne illnesses, or actually just damaging their health long term as well. And so I do feel quite passionately that these are another group who should be really on board with protecting our current British food standards for their own ability to succeed.
And within that age group as well, I think it's really worth pointing out that the vegan movement has really taken off amongst that kind of millennial and a little bit younger, those generations. And I think part of that is to do with animal welfare, and to move into this system where animal welfare is basically out of the window goes directly in the face of what people are interested in. I think if we can engage that group, you're completely right, we could definitely sort of try and mobilize a few more people, because I think, anywhere where there is low income, food is going to suffer, food choice is compromised. And also I think it's really important, and I know I've said it a few times, but if we think about schools, nurseries, care homes, prisons, places where lots of our most vulnerable in society are living, that's where these cheaper food imports are most likely to have the biggest impact. And school meals at the moment are much better than they used to be, but ultimately all of our children go through the school system, and if that means that every child in this country at some point is exposed to very poor quality food, we're in real trouble. Absolutely.
And I think the other thing that's really key as well is to put the emphasis on just the extent to which this bill will affect everyone, is that some of our leading supermarkets have made a blanket statement to say that they will not sell, for example, chlorinated chicken. But not all of the supermarkets have made that statement. But what the supermarkets do recognise is that they're ready to heat and ready to eat products, which is like your pizzas, pies, your ready meals, for example. The meat source from that, the supermarkets go to an external producer for those, and they can't control where that external producer gets the food from. And so actually, as much as you might not see the raw chicken breasts on your shelf, if you're buying anything that is pre-packaged, which we all do because we live in a convenience-driven world, you will be subjected to, or you're highly likely to be subjected to, these foods that we're talking about without even knowing.
It's quite frightening to kind of think about so many people being affected. It was suggested in recent reports that it would cost our economy 1.17 billion in days off sick and costs to the NHS. I mean, I don't know why people aren't talking about this more, to be honest.
I don't know.
You guys are terrifying me.
I think until something happens, it's hard to forecast what's going to happen. And I think the debate around Brexit has dragged on for so long that people are disengaged from it. It's kind of I think there's a lot of parallels with the Iraq War. It built up and everybody was engaged, and now it's kind of like, we don't want to be talking about Brexit anymore. But now we are absolutely at the crunch point, and we've got our dodgy dossier for sure. Now we know that Brexit, it really is built on this Americanization and race to the bottom, and there is a chance for us to bring change, because why? There's a lot more people in this country than there are politicians, and so the only choice we've got is to take it back into our own hands and become activists and really engage with our parliamentarians to really be aggravated and insist that they vote in the agriculture bill as it comes back from the House of Lords into the House of Commons this autumn, and we want our MPs to vote for the amendment which stops the wholesale imports of bad food, which will decimate the country.
It's also just a bit of a missed opportunity in lots of ways. I think that there's things like food labelling. You know, we could take, this could be a really positive step that we take in this country. We use this opportunity to look at the agriculture bill, to look at food policy and say, hang on, what do we want to take forward? What do we want this to look like? What would be better for everybody, you know, rich and poor and everybody else? How could we make things better for people? And I've seen people talking about trying to, offset the cost of fruits and vegetables and subsidise farmers so that growing fruits and vegetables is more sustainable and better economically, which would obviously help us as shoppers and buyers to be able to afford fruits and vegetables that are homegrown and all that kind of stuff. Air miles, food miles and all those sorts of things are kind of on people's agendas, but they could be more on people's agendas. And I think that we have this opportunity, and at the moment it's just being completely pushed in the direction of everyone's health suffering, as opposed to the opportunity that we have to maybe really improve people's health.
I think
absolutely. And I think something that struck me when I was sort of researching this is that the House of Lords did release a report this year, and it was called Hungry for Change, Fixing the Failings in Our Current Food System. And in that report, the House of Lords, the committee who wrote the report, stated that the government should absolutely be subsidising fruits, vegetables, legumes, pulses, lean meat, so we can promote a much healthier diet in the UK. And the report continues to find that unhealthy foods like highly processed fats, sugar, salt, it continues to be 3 times more expensive than the healthy alternatives that we're talking about. And so it's not like the legislation isn't there to prompt the government or to instruct the government that we should be going in a more health-orientated direction, improve the public's general health. This goes completely against all the recommendations that are thrown at the government from the British Medical Association, the House of Lords, dietitians, doctors, the country, and the public as well. It just goes against everything that we ask of our government.
And it's important to point out that we can go in a different way. This isn't the only option, and it's just making sure giving people the confidence and the ability through the campaign to get their word out, to get to their MP, to realise and talk to other people about public health and that it will impact it. It's not just about farmers, it's not just about their livelihoods, it's about you and your food.
Absolutely.
Liz, would you like to quickly explain what is happening going forward with the campaign so that anyone that is worried can get involved and can join?
So to get involved in the campaign is quite easy. On our website, savebritishfarming.org, there's a facility to sign up, and you'll get newsletters and any information coming out about future things. There's also a letter writing facility, so you put in your postcode and we've got a pre-written letter there for you to send off to your MP very easily via email. But I would urge you to put your own personal details in there as well as to why you're worried about the changes that are coming and why you want your MP to represent you. And we will be rolling out these banners now, which we want people to have in their gardens and on their farms. We'd like to see these Save British Farming banners all over the country as if it was an election, because as MPs drive around their constituencies, they're going to see that the people are very, very worried. So it's actually a very easy form of activism. You don't have to go and spend money going to a march or risk your health by going to a march and being scared of COVID. All you have to do is get a banner or a poster, and we will have one that you can just print out at home, even just to put in your window, so that we see Save British Farming everywhere. Because I really believe that if 80 to 90% of the public don't want to lower their food standards, then really we should see a sea of red absolutely everywhere. Then in the autumn, we will be doing a regionally coordinated demonstration, which will involve meeting at cattle markets, driving, because of the pandemic anyway, we don't want people to be gathering in close groups together, but tractors and farm vehicles and just ordinary cars to drive around the local town and then come back to the cattle market, where we'll have some keynote speakers and a rally and keep people engaged in this debate.
That's great. I really look forward to the summer campaign coming up. I can't wait to see all the fields filled with red, and all houses as well, and cars, because it does affect everyone. It's not just a farmer's responsibility to campaign for food. Guys, with your expertise, what would you suggest or like to say to people that in their letters they will have the option to write their own statement? What would you suggest would be impactful and key points in the agricultural bill and public health to include in the emails?
So if I think about where I live, so I live in Hackney in London, and I think perhaps this isn't on the agenda very much for people, and yet it will have such a big impact on the constituents that are part of my community. And you know, we are one of the poorest boroughs in London, and there's going to be such a big impact for everyone who lives in this borough. And so I'm certainly putting in my letter about how much of an impact this will have, even though farming seems like a distant thing to people who live in central London. We must take action to protect those of us who do live in cities as well as in the countryside.
Yeah, I think in my letter, I would just be saying something along the lines of that. I just find it absolutely abhorrent that my health is at risk because of their trading deals. The health of my family, of my loved ones, of my community, of the patients that I want to care for. I want to do the best job I can when I go to work. I want to care for my patients, and I cannot do that if you're going to provide them with food that leaves them at risk of serious harm.
Perfect, thank you guys. What would you like to add to that?
I would say, because I've got a very, very avid Brexit supporter MP, and I know that he doesn't get on with everybody in his local party. So I've had a lot of communication with him, and it's literally falling on deaf ears. So I am going to be contacting the local association, the Conservative Association, and I'm hoping that they will have more influence on him than my communication. So I'm going to be saying to them why in this constituency, which is largely rural and agricultural, that it's very, very wrong that our MP is not representing our interests in effect, he's backing American farmers, not British farmers, and that's very, very bad. But also from a health perspective, I don't want to eat bad food. I don't want anyone in my family or any of my loved ones to eat bad food either. And I certainly don't want the most vulnerable in society to be suffering more than they need to. So, yeah, I'm going to be writing to them regularly and putting my point firmly.
I'd just like to close, maybe, by saying that I think everyone can see the obesity epidemic that we have in this country. Everyone sees the problem we have with diabetes. Everyone sees the problems that we have with childhood obesity, childhood illnesses. We see all these issues with, cancer is on the rise. All of these problems are going on. And what we're talking about is taking something that fundamentally is already not great in terms of our lifestyle related diseases and putting them at even greater risk. Yeah. When we look at all of these things in America, we can see that their food system puts them at greater risk than we are currently. And what we are talking about is putting those people, all of us are already at risk, we're all putting us at greater risk. The government are putting us at greater risk for financial benefit. And to me, that is just absolute madness. We're already in the midst of a crisis over these things. To put us all at greater risk is completely against everything that anyone wants in this country, and we must fight it.
Just touching on the crisis quickly there, do you think this hasn't been at the forefront of public health news, of dietitian news, because they are so focused on COVID at the moment? How are we going to break through that? Are we going to be heavily relying and encouraging people to talk to their friends and family about it, because they've got higher concerns right now?
Yeah, I mean, Gabby can speak of the NHS, but I think everyone is fighting COVID on the front line, and ultimately there's only so much capacity. I just feel very strongly this is being snuck through the back door while our heads are all turned by COVID.
Absolutely. And I think, the difficult thing as well is that this is a relatively depressing conversation to have on top of already exceptionally depressing matters at the minute. And people don't want more bad news at the minute, but the problem is that this is so important. And I do think if there wasn't a pandemic going on in the country and our voices could be heard louder, people would know more about it and people would be genuinely concerned. It's just that we have a pandemic masking it at the minute, which the government are really just allowing as a way to just kind of coast through and carry on without us really realizing. And so it's so important that you talk to your family, you talk to your friends, you share it on social media, you get your voice heard, because then it gets everybody else's voice heard.
That's such an important point as well, that compassion fatigue as a nation is just at its highest. You know, people can't cope anymore, but what is more important than your food right now, especially during a pandemic where you've already got impacts on health? So definitely completely agree with you. If there's anything else that anyone would like to say to summarize, that'd be great. But I would like to say a quick thank you to all of the volunteers at the campaign, and especially to you guys and Gabby for her amazing research on the campaign. In the nutrition and dietitian world, we're mainly farmers, so it's amazing and lovely to have Sophie and Gabby's support with this.
Thank you very much.
Thank you for having me. No, it's a pleasure. I'm very happy to be involved.
Yeah, same here. So pleased to be a part of this. Thank you for having us.
Thanks very much, everyone. Thanks for your contributions, and we'll see everyone again soon.
Perfect. Well, I'll say bye to now, and we'll get another panel together, I'm assuming, at some point. So have a good day, guys.